Good morning. My name is Donald Campbell. I'm the chairman of the Bennington Select Board, and we're here for a community update on April 6th, 2020. There's a lot going on. For those of you that are following this closely, you may feel somewhat updated to death. I know that the governor is giving an update as we speak. I think the health department may be doing one at noon, and there's going to be the Burlington mayor is giving a state of the city tonight at 7 o'clock. So there's quite a lot going on, but we are here for Bennington with our local folks to help figure out and get information out to the community that will hopefully be useful and important. So I'd like to ask everybody that's on today to introduce yourselves. We'll go alphabetically, starting with you, Brian. Sorry, Brian, I haven't got you unmuted yet. There you go.
All right. Brian Campion, State Senator for Bennington County and Wilmington.
Yes, hello. Dan Monks, Assistant Town Manager for Bennington.
Hello, this is Ginny Jenkins, Vice Chair of the Select Board.
Am I supposed to jump in now? It's Stuart Hurd,
Yes.
Town Manager for Bennington.
Thank you, Stuart.
Hi, Wendy Morris.
Go ahead, Trey.
I'm Trey Dobson. I'm the Chief Medical Officer at Southwestern Vermont Medical Center.
Sorry, I jumped the gun on the alphabet. Wendy Morris, and I'm Regional Manager with the Vermont Department of Labor.
That's great. Well, thank you all for being on. I'm going to ask you all to mute yourselves at this point. But what we're going to look at today is going to fall basically in this order. We're going to ask Trey to give us an update on the hospital and the medical system, where we are and what we're likely to be facing over the next few weeks. And then we'll jump to Wendy, and Wendy will give us the inside scoop on what's important from the Department of Labor for people that are unemployed or underemployed or having any kind of issues along those lines. Then we'll go to Brian, and hopefully Brian will update us a little bit on what we can be looking at coming from the state. And the state's done a lot already. Very glad to have some of the legislation that's been passed already, much of it. I'm very glad that the open meeting legislation was fixed enough that we can do these meetings by Zoom. But there's a lot of other good stuff too that we'll get updated on. Then we'll ask Dan and Stuart from the town to give us an update on the town. We are going to try to take questions from Facebook Live as they go. And I'll try to keep up with that to the best of my ability. So I'll be curating that a little bit. This is not a select board meeting, so we won't be taking minutes. We won't be necessarily getting to every question, but I'll try to group the questions to the best of my ability and bring them forward to the group. We may lose Trey halfway through this program. Obviously, the hospital has a lot to do. We may lose Brian before we get to the end of the hour. So whereas last week we had everybody hold their questions to the end, I'll try to keep up a little bit more if you have questions for the speaker at the time. So again, thank you everybody for being here. Thank you for those of you that are tuning into this. And Trey, why don't you kick it off, please, and take all the time you need to tell us what's going on at the hospital.
Sure. Well, let me just start off by saying, Donald, that, and I've said this before, there is humility in recognizing there's much we don't know, and now I can say there's much we still don't know on how this pandemic will move forward. We can say that the models, and of course, Brian was part of releasing those models from the state, show these peaks, and those models seem to really work in predicting urban areas, urban cores where you have a lot of vertical living. But what's not so clear is how they're going to predict increase in patient volume and increase in sickness in rural areas where people are spread out. And I think people know this, but I lay that out to say we don't know how that's going to affect volume, both outpatient and inpatient in our hospital system. So we are preparing and have been preparing for an increased volume of up to 2.5 times our usual volume, up to about 100 patients in the hospital itself. That will be very taxing. It'll be taxing to staff and resources, but that's what we are looking at if the peaks do occur at the levels that some of the models are predicting. So I'm going to go back and start talking about testing. You know, we are testing patients. I know there has been some concern with the community that we're not, but we are testing patients. The materials to do that testing have been limited, but are growing. In other words, we are gaining access to more testing material. And by the way, we're no different than any other hospital in the state in trying to get these testing materials. We also know that the tests are pretty accurate if you're symptomatic and you're sick with the disease. And if you have no symptoms, then the tests aren't as accurate. And that is one of the reasons why we don't test people who have no symptoms. In other words, the results of the tests are not very meaningful. And I know people have questions about serology testing, which is a little different than what I'm talking about right now. So for patients that are symptomatic and meet certain criteria, in other words, age, associated illness, or severe illness, those can all be tested, both outpatient and inpatient. Your doctor or your provider would simply call our laboratory and we would get those done. We do outpatient testing. We've been doing about 10 to 15 a day, and we have the capacity to do more. But again, we can't test people who aren't symptomatic because that, first off, uses the material for other people that need it, and second, it's not accurate. And it's kind of hard to explain that when you have the people at the federal level pushing testing, not recognizing the intricacies of the science there. But testing itself is getting better. I am very confident that within a few weeks to maybe just over 6 weeks, we'll have some very accurate testing throughout the country, including serology testing. And I'll remind people, serology means you can tell whether or not you've had the infection in the past, which will be important. For outpatient, patients that are sick and have a fever or a cough or shortness of breath and may have COVID, the process is to speak with your provider on the phone. And all of the doctor's offices in town and at the hospital have moved towards telephone and telemedicine for a majority of their patients. And they are managing these patients in their homes to a certain level. And then if it gets to be a point where the doctor thinks the patient needs to be seen and evaluated in person, then we have opened up what we call a respiratory evaluation center. And that's adjacent to our emergency department. And patients come in and are evaluated for COVID as well as any other upper respiratory tract type illness, and usually discharged home. That's the important part there. If they need to be admitted to the hospital, then they come into our emergency department and then eventually go into the inpatient area, where we have opened up additional rooms throughout the entire system so that we can eventually accommodate about 100 inpatients. And just to put that in perspective, our typical census is around 35. We've also converted about half the rooms, 45 of them, to what's called negative pressure. And those are the rooms that are preferable when someone has a communicable disease such as COVID-19. So we've gone from about a handful of negative pressure rooms to 44 of them, which is quite a number. I just want to talk a little bit real quick about what our priority is in the hospital. And I want to make it clear that our priority is staff safety. So staff will always be wearing the corrective gear that you've heard the term called PPE, which stands for personal protection equipment. That includes a face mask, a face shield, a gown, and gloves. And if they do not have that equipment, they will not treat a patient. So we make sure that equipment is available, that they're wearing them properly. There is no reason for our healthcare staff who are working so hard to contract a disease at work and be sick and be out of work and transmit that to their family. So it's our number one priority, and we say it before every meeting that we have on this topic. And then the last thing is, before we go to some other questions, and I'm sure I missed some things, is wearing face masks, because this has obviously changed quite a bit over the last 30 days and then really over the last 72 hours. But in the hospital, staff are wearing a particular type of procedural mask that you might think about when you go to a doctor's office, and they're wearing a face shield, and that's because they're interacting with patients and they're using that mask all day long. If you're not interacting with patients, we're still requiring all staff, as of this afternoon, will all be wearing some type of mask. We're hoping that'll all be procedural masks, but if we don't have enough, and you've heard that supplies are limited, then they'll be wearing their own homemade face mask. And we encourage everyone to adhere to that CDC recommendation that folks in the community, when you're out and you're around others, if you have to be for a necessary shopping trip to get food, that you're wearing some type of face mask. And then I do want to say you don't have to make a face mask. We're all Vermonters and we all have face masks. That's what we ski with. That's what we get outside with. And those are perfectly fine. And they're not actually too hot. And you've got them available. You just pull them up over your face. And if you want to make a face mask, or if you want someone else to make you one, because it's a good project, then that's great. But there's no reason you can't just pull out your old ski mask and that'll be fine. Not the ones with the holes in them. It has to be the ones that you go around the neck and you pull up around your face. So I'll stop there. I will say that the staff are incredibly engaged. They're incredibly resilient, but we pay attention to this every day. They're humans. Some of them are going to get sick. They're going to contract the disease out in the community like others. And we want to do our best to keep them safe and healthy and working at the top of their game.
That's great, Trey. Thanks. I'm going to ask you just on behalf of, I'm going to give you a little bit of a leading question here, and you've answered some of this, but if you've been following for everyone who's following the news closely, it's frankly terrifying. The numbers that are coming up over the next couple of weeks. And so I wonder if you, I don't want to be fear-mongering, but I wonder how we locally are to interpret the kind of information we hear coming out of New York City and some other places.
Sure. So, Donald, I can say that we will see lots of cases. And what's been going on is I heard this comedian say that this is like a tiger chasing us very slowly. We can see the tiger coming at us, but he's just not here yet. We can see it on the media, and it just increases the fear and anxiety. But for anyone to think that we're going to escape that would be like saying 1 year Bennington doesn't get any flu. Of course, we are going to get COVID patients. We've already got COVID patients, as you're aware. We've had them in the hospital, and we've actually had a few deaths. So we know that the volume is going to increase. We are hopeful that because of all the protective measures that have been put in place, and because of the fact that we live spread out and not on top of each other, that the increase in volume of patients and people in the community that get the disease over time is spread out, which goes back to what was started in mid-March and in early March in the media about flattening the curve. We're very hopeful that'll happen. It is possible that we do get a surge of patients who are ill in the community, who are having respiratory failure and need to be in the hospital and be admitted. We are doing the best that our staff can with the resources we have. We have 10 ventilators, 9 or 10 ventilators. We have multiple rooms in the hospital where these people can go. The state has acquired a few ventilators that they are going to be handing out to different hospitals based on need. We also have the ability to transfer patients if that is the way the trend works to both UVM and Dartmouth-Hitchcock. And if it gets a point where, Donald, where it exceeds capacity, then we'll just have to manage it the best we can. And that's what you're seeing on the media in places like New York City, soon to be Atlanta, Philadelphia, and other major metropolitan areas.
There's one question that's come in over Facebook Live. I think you've addressed some of it, but the question is, what precautions should residents take if they need plumbers or electricians in an emergency situation?
Sure, and they will, and that's a great point. So first off, both individuals, the plumber and the consumer, need to be wearing a face mask. You need to keep the social distance. There's no reason to be closer than 6 feet at all. You need to use hand sanitizer as the plumber enters the house. And as the plumber enters the house, you use hand sanitizer too. That right there is going to be, over 99% effective. If the plumber is in the house for a prolonged period of time, you need to make sure the face mask is worn the entire time and that hand sanitizer is used at a regular basis. Now, someone might say, what's a regular basis? So about every 20 minutes, if you're wearing a face mask, is plenty sufficient. People that aren't wearing face masks are supposed to sanitize their hands every time they touch their face. And you just don't, that's kind of unrealistic. It's hard to remember when you touch your face. So wearing a face mask has many advantages that may not be apparent. One, I just said, wearing a face mask prevents you from touching your face. The second, when you speak, you're not, pushing out respiratory droplets. And then lastly, you're really protecting the other person. Wearing a mask may give you a little bit of protection, but mostly it's protecting other people. So if everybody wears them, then everybody's protected.
Well, that's great. So I know that you can't stay on forever. If you'd like to stay on for a little while longer, Trey, we'd love to have you stay on.
Sure.
But I'd like to try to transition to Wendy here and give her a chance to talk about what people are facing in terms of employment challenges and some of the things that are coming at us in that direction. So, Trey, if you have to leave, by all means, log off. And if you can stay with us for a little while, we may have more questions roll in as time goes by. Thank you very much. So, Wendy, yeah, a lot of people unemployed, record unemployment numbers coming in, and a lot of social dislocation potential, but sounds like our state Department of Labor is really on it. You want to tell us where we are right now and what people can be expecting and doing?
Yeah. So just to kind of put some things into perspective, we are working really, really, really hard around the state and trying to respond to the enormous volume of claims that we're now seeing. Just what we're asking is for people to be very patient as they can be at this difficult time. Just to put that into perspective, the number of initial claims that we received from March 22nd through the 28th was 27,000 claims. The number of initial claims for the same week in 2019 was 4,841. So it was an incredible jump in volume. Total number of initial claims received to date since March 15th, 2020 is 63,000. So we're talking unprecedented volume of claims that we're getting all at once, which is a little crazy. We have had, a number of people that have had some struggles trying to get through to claim lines, trying to file their initial eligibility application for claims, and who have also had some struggles in filing their weekly claim. But know that it's the volume, it's the sheer volume. We have developed as a state some really quick response to allowing individuals the ability to file their weekly unemployment claims. And when I say quick, I mean really quick. We quickly sprung into action and developed an online claimant portal where somebody who needs to file for their unemployment benefits and provide that initial application for unemployment can now do it in a couple of different ways. They can certainly apply for those benefits right through the labor.vermont.gov website. And at the very top of our website, there is a red link that allows somebody an opportunity to complete their initial application for unemployment benefits. That's actually new, and that was in direct response to the sheer volume of unemployment claims that we were seeing. You got to remember that our system was really set up on historically low unemployment rates. So for us to all of a sudden spin gears into a completely different direction, it's been we've had to put a lot of action in place, and we have. I'm not saying that our system is perfect at this point. We're still working through all of the kinks that we can, but we are working very diligently and trying to make sure that people that need those benefits are going through that process as quickly as possible and getting access to those benefits. So, you know, the process with unemployment is very confusing and can be very confusing for people. So if I could just run through sort of what that process is and what that looks like. Oh, can you guys see me okay? Okay. Something just happened on my screen. I didn't know if I hit something. So that process for unemployment benefits looks like this. So as soon as somebody is in the situation of a job loss, whether it's temporary or whether it's permanent, the first step in that process is to file the initial application for eligibility for unemployment. And some people get confused about this because I think our website still calls it an initial claim. But really, if you can, in your mind, think about that as being your initial application for eligibility for benefits. From that, people are in this sort of processing phase of their claim. So they've completed that online, then they're in this processing phase for their claim. And within that processing phase, there's a significant amount of work that's done on the back end by folks that work for labor and trying to make sure that claim goes through the system so that we can get that claim to the point where the links open up so they can file their weekly claim. The initial application, what that does is that tells the unemployment system that, hey, I'm Wendy, I lost my job and I need benefits. After the system determines that, yes, I'm a person that should receive those benefits, I then need to every week tell the system, I'm Wendy, I still need those benefits, and here are the conditions that exist. And so they will file their weekly claim, and that can be done in a couple of different ways. And all of this information is directly on our website. But they can file that weekly claim through the online portal, or they can call as well. And within that, sorry, my door opened. Within that, what they're able to do is they're able to file that weekly claim, and then those benefits go through. I'm going to pause just a sec. I need to close. Sorry about that. The challenges of working from home, right? Which we're all experiencing. So once a person does that with their weekly filing of their claim, essentially the weekly filing of the claim works very similar to people's traditional paychecks. Most generally speaking, people aren't necessarily paid in the same week that work occurs. They're generally paid for work that occurred the previous week. Our unemployment system works the same way. So starting Sunday, people can file their weekly claim for activity that occurred the week prior up until Saturday. And again, they can do that a couple of different ways by calling toll free or by going right through our claimant portal and filing online that way. So it's just, I think it's important for people to understand what that process is. Right now, that processing phase between when somebody files the initial application to when those links open up and they can file their weekly claim, that processing phase can take a little bit of time for claims to get through. But we're trying really hard as a state to make sure that that processing time happens as quickly as possible so that people can then begin to file their weekly claims. There is, and I'll provide the information, all the contact information, but if you were to go to the labor.vermont.gov, and it's the full word Vermont and gov, website, there's all sorts of information regarding unemployment benefits, and there's all sorts of information regarding the CARES Act, which is also new. So with the CARES Act, There's a couple of things that I just want to point out with that. There is CARES Act does provide unemployment benefits for self-employed and independent contractors. And these would be individuals that historically would not qualify for unemployment benefits, but under the CARES Act, they now can. The department is working to implement a new system in the coming weeks. And this is something that, because it's so new, we don't have the system fully developed, but we're in the process of doing that. And again, we're springing into quick action with that. Any delays in that will not impact the benefit amount, as benefits will be able to be retroactive starting week March 29th. If you're self-employed or an independent contractor right now, what we're asking that you do, or encouraging for you to do, is you can sign up for the self-employment newsletter, which will provide all sorts of information on the action steps that the department is taking. And you can actually submit an initial claims form. So this is the initial application directly through our website. And that will at least get the process started for benefits with Department of Labor. The other part of the CARES Act that people are most wanting to know about is the increased weekly payments of $600. So anyone that currently has an unemployment claim is eligible to receive the $600 additional payment per week. And your action doesn't require any further action other than filing as normal for weekly benefits. And that benefit will be effective for the week of March 29th to April 4th. So people that are filing for that week, that benefit could be available then, starting then. And then the other part of the CARES Act that a lot of people are wanting to know more about are the extended benefit portions. And so the extended benefits are for individuals that have exhausted their unemployment benefits during the current year. And it does provide up to an additional 13 weeks of unemployment benefits. Typical benefits provide a maximum of $513 per week for a benefit of up to 26 weeks. This actually provides an additional 13 weeks on top of that. No other further action is needed other than filing as normal for weekly benefits. And that, as well as the last one, becomes effective March 29th for the week March 29th to April 4th. So there's definitely a significant amount of work being done on the unemployment side. And I would be remiss to not inform everybody that even though Department of Labor, a lot of our focus has been around assisting on the unemployment side, and that's been true of all of our services in the field office. We're still very much open, and we are still assisting individuals with job search and access to training and any of that sort of career exploration stuff. We're just providing all of those services virtually in a virtual world. We're even starting to roll out workshops that include resume and interviewing and some other things that we have going on. We're just doing it in a virtual kind of environment, which may be really great for some folks right now who, maybe they've been out of work for a while. These services don't have to stop just because COVID is here. We're just doing it in a very unique way now. And if anybody wanted to gain access and wanted to schedule an appointment with any of the staff, all of our front desk phones are being answered by a real live human being, not a machine. And so you can call during our normal business hours, which are 8:15 until 4:30, Monday through Thursday. And on Friday, it's 9:45 until 4:30. And get a real live, actually, we're actually staffing the phones now until 6 this week. But you can get a real live human being and we can schedule an appointment to have you virtually meet with one of our staff and explore any of those other things that you may need regarding, job search, career exploration, just, connecting to possible training, because at this point, though we're in this situation right now, we won't be in this situation forever. And in a matter of a few months, if you're somebody who's not going to be returning back to your occupation, you want to be ready to be able to rebound to something else. When all of this is over and people are returning back to work and social distancing is hopefully a thing of the past. So just putting that out there, that's something that we're able to do as well.
Wendy, that's great. And it's, I think in these times, it's particularly important for people to be able to talk to somebody. I think it's pretty easy to feel overwhelmed by all the websites and addresses and links that are out there. And really nice that there's a way for people to call and get help. And if you'll forgive me just for a second, I'm going to segue back to Trey, who has to get off the call. But one of the needs that the community's identified is this kind of ability to talk to somebody when you feel like when you need to talk to somebody, whatever the problems are. And so I believe it's the hospital, Trey, has set up a warm line. So this is not a hotline, but a warm line for people to talk to. And Trey, I'll let you talk just a little bit more about that. It kind of dovetails with what Wendy was talking about with a real person to talk to.
Sure, and I agree with you, Donald. There's so much out there. Every company and every organization has their own website about COVID-19, and that's great. SVMC has a really well done website, so I'd like for people to start there. It doesn't have everything about COVID, and what it has is things that you would want to know as a community member in Bennington County. And then there is a hotline listed there, so I can give you the number, but it's right on the website. And I'd rather you start with the website because you may be able to find your answer in a nice, clear way that you can refer back to. But if you need to speak with someone, then there's a number right there. It's 440-8844. But again, going to the svhealthcare.org website is a great place to start. And then also, if you do have a primary care provider, talking to that primary care provider, that's what they're doing now. It's a remarkable change in how medicine is practiced during a pandemic. And during a pandemic, it's practiced on the telephone and through the use of telemedicine. And then I also wanted to say something that I didn't address early, Donald. As people become infected, in other words, over 50% will likely become infected in Bennington County. And that includes all of us on this call right now. Fortunately, most of us, a vast majority, won't need hospitalization, but we're still concerned. What do we do? And people say, I hear you're not supposed to go to the hospital. Well, what you need to do is realize if you've got a fever or you've got a cough, you very well could have COVID because it's just spreading. And you stay at home, you home isolate, and you do that. And then there's these criteria, and they basically say, 7 days after the onset of your symptoms, if you've had 3 days without fever and improving cough or shortness of breath, you're done with home isolation in that regard, and you can go back with family. And that's what a majority of people need to do. They realize they're going to catch this disease. We're not going to have a vaccine in time before 50 to 75% of us catch it. We will have a vaccine, but just not before then. That being said, what about should someone come to the hospital? If someone's having trouble breathing or feels that they can't stay at home, absolutely come to the hospital. What we're trying to avoid is people getting a fever thinking, I wonder if I have COVID. Let me go to the hospital and see. We can't handle all those people. We need to take care of the really sick community members. But don't hesitate coming if you feel like you can't breathe. That's what we're here for.
Great. That's really helpful, Trey. Important distinction. I think you said you had to get off at 11:40, and so I'm going to thank you very much for coming back on and giving us that. And thank you for all that the hospital's doing. We are so lucky in this community to have such a strong medical center right in our community. I know people all around Vermont that wish they had a setup like we have. So thank you for everything that the hospital's doing.
Absolutely. And I'll also take the time to thank the nursing staff and the physicians here at the hospital.
grateful for them all. Wendy, I'm going to bounce back to you. A question's come in over Facebook Live. I'm just going to read it. And Brian, just give me a nod here. You can stay on until noon. Is that right?
Right.
Okay. So Wendy, one of the people wrote the following, and I'm just going to read it verbatim and let you sort it out. It's, what if you're eligible for unemployment and you received paperwork to file your claim from Department of Labor? However, when you try to file your claim, it refuses your social security number. Can't get through on the phone. How do I know the status of my claim? Does that make sense to you?
Yeah, it's a question that we've been getting quite a bit. So if anybody has questions specifically about their claim and their status of their claim, there's a couple of directions that they can take. They can call the claimant assistance line first, which is 877-214-3332. That number again is 877-214-3332. They'll just have to keep trying to call that line to get through because they're receiving a number of calls. When somebody is needing to file an unemployment claim and they're getting that Social Security error issue, where it says their Social Security number can't be found, there's generally two reasons why that happens. One is they've already filed their weekly claim that week and the system doesn't allow them to do it twice. Or there is still some sort of, they're still in some sort of processing phase, and they can't really get to the point where they can file their weekly claim until they're completely all the way through that processing phase. Unemployment does try to communicate as much as possible via email directly to claimants. On our website, there is a frequently asked questions section directly to, for employers that are have questions about the unemployment system as well as job seekers. The other thing that we're strongly encouraging people to do is to sign up for the unemployment newsletter, because the unemployment newsletter will often address those questions that a lot of people are having and the frustrations that they're experiencing. Our system throws off errors sometimes. It's, again, because of the sheer volume, it can only handle so much. So it does definitely cause these kinds of questions, but there are resources to get the answer.
Thank you, Wendy. One more question, and then I'm going to jump to Brian here. But there's a question: is there still a waiting period?
No, my understanding is the waiting period has gone away. So it is, but it's that processing period that, again, it's just taking a little bit of time for some claims to go through. Some claims go through much quicker than others, but it does take a little bit of time for some of those claims to go through, but it's not a waiting period. I do want to just mention two things though, if I could real quick. One is the virtual town hall meetings. So last week, Department of Labor launched their first virtual town hall meeting specifically for employers. And anybody who missed that can actually go right to YouTube or go to the link on our website, and you can still, it was recorded. So it's about an hour long. There's a lot of super valuable information in there specifically to employers. What I had heard last week was we are planning on doing a lot more of those virtual town meetings for employers and rolling them out for likely rolling them out on the individual side too. So those will be posted on our website as well, but there's great information in there that could answer some of the questions that people are having as well.
Great. I know I said I was going to jump to Brian, but one last question's come in for you. I think you may have addressed it, but I'm not sure I heard the answer. Can people who work part-time apply? It's the question that came through.
So anybody can apply for benefits. This is what we tell people. It doesn't hurt you to apply for benefits, and then the unemployment benefit or the unemployment system can shake out whether or not people are eligible or not eligible. Our role in the field offices is not to determine eligibility. We can't even predict whether somebody's going to be eligible or not. The only role that our staff take is to provide the links and provide the information on how people can apply for benefits, and unemployment can shake it out that way. The unemployment law and process itself is very complicated, and there's so much background work that happens that, you know, anybody, any one of us could say, yeah, you could apply and, you know, you'd be eligible, but then they get through that background stuff and they may not be. So this is why we don't determine anything with eligibility. Unemployment system determines that, but somebody who's working part-time can certainly try to file for benefits. There's no harm in that.
Great. Okay, well, thank you, Wendy. I need to move on here, but I hope you'll stay with us. There may be some questions at the end.
Yep.
Brian, you know, the state has been doing an amazing job of trying to keep up with this stuff here. I know that you had a lot of issues on how to vote for things and how to do remote voting and whatnot. We've certainly heard a lot about that down here. But also just some really good legislation that's either been passed or is in the works. And I wonder if you could summarize some of that for people,
Sure.
since we're really looking to the feds and the states for leadership here, and we're finding, I think, most of the leadership coming from the state, quite frankly. So love to hear what you have to say.
Thanks, John. And I just want to start by thanking everybody in the community that has really pulled together. It's been quite incredible. The hospital, certainly, the town government, people who are working the front lines at grocery stores, people who are picking up our trash, during the week, all those folks, mail carriers. I know people like Vicki Lampron are out there making masks. So it really has been an incredible coming together, and I want to just take that moment to thank everybody. Just briefly, a few things. People probably followed House Bill 742, which did a number of different things when we were back at the State House a couple weeks ago. It extended Vermont unemployment benefits to include those people who have been, of course, left unemployed, people who need to self-isolate, people who need to quarantine because of possible exposure, people who are caring for family members. All of those kinds of things were in that bill. We also expanded access to telemedicine. We took a look at some education services. And as you mentioned, Don, we did quite a bit as it relates to town meetings, public meetings, future voting, that kind of thing. We're heading back to Montpelier. The Senate is on Wednesday. First and foremost, we are going to be taking care of another voting issue that has come up, and that is allowing the Senate to vote remotely on Senate bills. I think we might be the first in the country for a state government to do this. It's a really important step. This is, as everybody has referenced, this is a serious emergency. We do not want to not be able to pass legislation because we cannot come together in the same room. So we'll be returning on Wednesday to do that. All Senate committees are also looking at a number of different issues that people have brought to our attention. I think one of the very first things you may see the Senate vote on later this week is a temporary moratorium on evictions and foreclosures. This isn't legislation, again, as it's being drafted right now, that would allow people to forego those payments, but just give people some temporary relief, a bit of a break, so that they cannot be foreclosed upon or evicted. I know the Education Committee is looking and concerned with how special education services are being rolled out at this point. It's been identified that this is a particular challenge right now. I also know that the Agriculture Committee is looking at what's happening to farms and with a specific eye to farmers markets. And I think one of the things that we're all looking and still waiting for is we know federal money is coming. We know we need federal money. Revenues are down significantly. It's not only a bleak forecast for 2021, but a bleak forecast for 2020. And those federal dollars are going to be essential to not only Vermont stabilizing and rebuilding our economy, but to all states in the United States. And once we have more information on that, we'll make sure we get it out to folks. But that is something that we are all waiting on. I think in closing, I just want to reiterate what I believe just about everyone has said, in particular what Trey has said around this is an incredibly serious time. Sounds like most Vermonters, more than 90% of Vermonters are taking this quite seriously. We need to continue to take this quite seriously. We have a new guideline around face masks. I know there are people out there who might not feel comfortable with that. I think we all need to be comfortable with that, but it has to happen. We are seeing deaths, we know, in our community and throughout the state. This is something that the more we can do together to encourage people to stay at home, isolate. It's a challenging time, but it's something that has to happen. So with that, I'll see if people have some specific questions. There a lot of other things are going on. I may have left out a few things, but why don't we leave it there for now?
Really great, Brian. Thank you very much. So glad to have you all working so hard up there. We'll know more after the Burlington mayor gives his presentation tonight, but it sounds like things may be getting fairly restrictive up there. One of the questions that came across is not quite in your court, but a question really about fines for, are there fines now in Vermont for not staying in place? And I'm not entirely sure what the answer is, except that I think I heard on VPR this morning that Burlington is considering fines for people who are not staying in place. I believe
the city of Burlington may have already started issuing fines. It's probably a municipality by municipality decision at this point, but I believe Burlington did start to issue some fines. I've not heard anything about a statewide decision on that kind of thing, nor has there been a discussion at this point.
There are also a couple of questions that revolve generally around tourism, Garlic Fest, lodging, helping these industries out. I'm sure that's something that means a lot to you and a lot to everybody else. Very Absolutely. Difficult thing to get at, but
stabilizing and then rebuilding Vermont's economy is second only right now, I believe, to the health of our Vermonters. We've heard an awful lot from small businesses. We know small businesses are struggling. There are things that the legislature can do, but I think we also know that the dollars really are going to be coming from the federal government, and that is what is going to help us stabilize and move forward. And how we use those dollars is still to be determined. As those dollars come in, some of them will already be predetermined, if you will. Some will come in with sort of flagged for certain areas, whether it's schools, whether it's for hospitals. And then I suspect it'll be a combination of the legislature and the governor working to find and direct those other dollars.
Yeah, that's great. Great.
I would encourage, I really do appreciate, I receive regular messages from small businesses throughout the county. If people have questions, if people have other questions around unemployment, first of all, Wendy's doing an incredible job. I've also been very pleased with how the administration is doing in general. But if people have specific questions, they should feel free to email me, email their state rep. Happy to get people the most accurate, up-to-date information as possible.
I'm going to shoot one more question at you because I've been wondering about this, but the Secretary of State recently has given out some interesting information on elections. What are your thoughts on kind of the upcoming elections?
So without a doubt, this is going to be a very different election cycle. I think it is going, Vermonters in general, a lot of our elections are door to door. A lot of them involve personal contact. It's quite possible that those kinds of things may not be allowed. and maybe very restricted. So I think it's going to be a different time, even voting by mail, continuing to conduct meetings like this. It's going to be a challenge. But again, first and foremost, we need to protect people's health and safety. And going around this fall and summer just might not be able to happen like it has in the past. And I appreciate the Secretary of State's. It's a tough message, but the reality is we're learning more and more how easily this disease can be contracted. And knocking on people's front doors, shaking their hands, coming in contact at this point is not a good idea. And I suspect even if there are some things that are lifted, throughout the country, what we'll see, and what I'm learning, is possible waves of restrictions. Certain states, certain municipalities throughout the country continuing this kind of assessment and response for the near future.
Great. Thank you. Thank you very much for that. I've got one more question here. It doesn't really go directly to you, Brian. It would probably be best answered by our chief of police, but Stuart, Dan, you may have some better response to this, but let me just throw it out there. There seems to be a lot of confusion regarding freedom to cross state borders. Are there restrictions for nearby New Yorkers to come and go and for Vermonters to go to and from New York and Massachusetts, etc.?
I can actually say a word on that. That came up this morning in our Senate meeting. I know there are police officers, I was told, who are stationed down by the Vermont-New York border. There are no restrictions. As far as everything I've heard from Legislative Counsel, this would violate interstate commerce law. There are also some concerns that, and I know that I think Senator Sears' committee is going to start to look at this as it relates to civil liberties. Are, for example, police officers taking down license plate numbers? What is happening with those numbers? Those kinds of things. But we know there are people over our borders that use Vermont grocery stores, Vermont services. This is part of their extended community because of the proximity to these stores and healthcare facilities, etc. So right now, the governor has issued a guidance of out-of-staters who are coming to this state to quarantine for 14 days. And I hope people will respect that. I know we've all heard a number of people very concerned about this over the state border kind of thing. And I think it's absolutely legitimate that people coming from out of state, from particular areas, could be spreading this. And I hope they will respect the quarantine. I actually hope that they will, first and foremost, consider staying put in their own state before they come here and use a second home.
Good thoughts. Brian, I know that you have to get off at noon. We're going a little longer than I had hoped. We're at 11:55 now.
I'll stay on as long as I can. I can stay a little bit longer.
Great, thanks. So unless you have any last thoughts, I'd like to flip it over to Dan Monks, Assistant Town Manager, and/or Stuart Hurd, our Town Manager.
No, thank you.
Dan has been the point person for the COVID-19 work, but I know you and Stuart are working closely on this. So either one of you would like to give us an update on the town and what you see coming at us?
I'll begin. Stuart may want to jump in. I guess the main message is that we're continuing to have the capacity to deliver essential town services. The PD remains at full force. Obviously, everybody's working under modified protocols to protect our employees and the public. The water filtration plant, the wastewater plant, our highway department are all functioning and providing the services necessary to keep our community going. So that's number one. We have closed all of our facilities to the public, so to protect the public and the employees. However, our town office remains staffed, albeit with a much reduced crew. We are available from 8 to 5 for phone calls. We have a receptionist taking calls and directing calls where they need to go, and all of our staff is capable of responding to emails and, of course, the old-fashioned way, the U.S. mail. So we continue to operate, but albeit under modified protocols to protect everyone. I do want to mention we have closed certain outdoor facilities such as playgrounds and basketball courts and tennis courts. However, all of our parks remain open for folks that can utilize them while practicing appropriate social distancing. So for walking, jogging, those sorts of things, we encourage folks to use those facilities, but please make sure that you maintain the appropriate social distancing. And we have closed those facilities that would make it impossible for you to do that. So like in the playgrounds or the basketball courts, et cetera. Donald may want to talk about this a little bit, but we do continue to have public meetings. The select board's going to be continue meeting by Zoom, and we're working on, Donald in particular is working on ways and how we can integrate public comment into those video conferencing meetings. It is challenging, but we're doing the best we can to make sure that everybody can continue to participate in the public process. I guess other than that, we're pretty much staying the course of following the governor's guidelines and directives to make sure that we are doing the best we can to flatten the curve. Happy to take any questions or clarify anything that I've mentioned.
Yeah, Dan, thank you very much. Stuart, is there anything you want to add to that, or you?
No, I would like to add a few things. I think it's important for folks to know that Dan and I are exercising extreme social distancing. We've made arrangements to avoid each other as we both work in the same building. I think that's important given his role initially, and now that I have returned, we're kind of splitting the responsibilities. Going forward, I think we're probably going to put up on our website some of the folks who are available, perhaps to make face masks. We are going to be supplying our employees with face masks. That process started this morning, and we'll all be following the governor's guidelines in that regard. And I trust that folks who are out there and shopping and doing those things begin to take this as seriously as we are here. Secondly, I think going forward, we're going to be looking to waive some late fees and interest fees, specifically as it relates initially to dog licenses because they were due at the beginning of this month, and as it relates to our water and sewer services. But we'll be talking about that Monday night at the select board meeting. That'll be on the agenda, provided, Donald, that you and Jeannie approve the agenda. So we'll look at that, and then we'll take a look as we move forward and see how this disease progresses or regresses, depending on your point of view, to perhaps look at other things that we might be able to do financially to relieve the burden that we know our residents are facing.
Great, Stuart. We look forward to that, and we'll do the best we can at the meeting on Monday. Brian, I see you've got your B up, but you may be indisposed at this point. But a question has come up for you if you get to a point where you can come back online. Yep, there he is. I know we're on borrowed time with you here, Brian. You're going to need to unmute yourself. And the question for you is about the restaurant bill. So April 15th, end of the restaurant bill that was passed with to-go alcohol. Will this be extended?
That's a great question. The selling, I suspect what they're asking is, will we continue after this is over to allow restaurants to take out cocktails? I know I've taken advantage of this. I suspect many people have. I think it's been a great asset to our restaurants and the community at this time, particularly to our restaurants financially. And the question is, I do not know whether or not we will continue that practice after the pandemic has quieted down and people are sort of back to normal. I don't see any stopping of this process as it has been put forward at this point. The one question that I think we're all waiting to get an answer on is whether or not restaurants altogether would ever be shut down, even for takeout. That has not been a discussion that I've been a part of. but I suspect the Department of Health and others are looking very carefully at it. But again, it hasn't been something that I've heard anything about. I think the way that happens is really if this continues to get worse and people don't abide by these guidelines and restrictions, and otherwise I see businesses as it's set right now continuing.
Great, thanks. And Brian, I recognize that everybody on this group, we've asked you to speculate the most today, and I kind of apologize for that, but thanks for giving us a little,
Absolutely.
thanks for speculating as able. I appreciate that. So I'd like to try to wrap things up here pretty soon if we can. I'm going to ask you all if you have any last words in just a minute, but one of the things that occurs to me about this time is that normally we really ask people to take care of themselves so that they can take care of their community, but it feels like at this time it's a little bit inverted. We really need everybody to take care of their community. So this thing about face masks that you were talking about, Stu, you know, that is really about making sure that we don't get other people sick. And if we don't work on keeping our community from getting sick, we're going to go down that terrible road that Trey talked about with the hospital. So we really do need to think almost first about our community, and we also, of course, need to take care of ourselves. Personal health, getting exercise, trying to eat as well as we can. And then third on my list, of course, is to make sure your neighbors, to the extent that you can, make sure your neighbors have help if they need help, and that you can check in with them at a safe distance, but to make sure that in your strength you can help your neighbors find strength also. So, Jeannie, any last thoughts from you? I know you've been doing a lot in the volunteer world, and I know that there's a lot out there with food resources. Many of them are up on the web. We talked about those a lot last week, but anything you'd like to say as we wrap up here?
No, Donald, I think the community really is trying to take care of itself, and I really appreciate all the heroes that are out there, which is almost everyone in this community at this point. So thank you.
Yeah, that's great. Wendy, I'm going to do the same for you. Any closing words that you'd like to put out today?
No, just thank you for inviting labor to today's session. If anybody's got questions or anything like that, go to our website, labor.vermont.gov. It's a great resource right now, given these times.
That's great. Stuart, anything from you? Any last thoughts?
No, I think your closing remarks really would echo anything that I would say to the community. I think it's extremely important that we take every precaution that we can in order to be safe and stay healthy.
Thank you. Dan, how about you? Anything from you, Dan? Oh, Dan's frozen up, it looks like. He may be having oh no, there he is.
Can you hear me, Donald?
Yep, got you now.
Okay. I guess all I would say is if folks do have questions, we remind them we are here at the town office 8 to 5, and they can call in at 802-442-1037, and we'll try to direct folks where they need to go as far as town business is concerned.
Great. Brian, I'm going to let you be kind of closer here. Anything on any sort of final sentiments you'd like to share?
Now, yesterday I was without a mask and was in town, and those days are over. Those days are over for all of us. So we just have to continue to take this very, very seriously.
Okay, well, I'd like to thank you all very much for joining us. Thank you for those on Facebook Live for your comments and for your following along with us. Special thanks to Cat TV, who makes the technology possible and who has just been an incredible partner throughout on all of this. It's not an easy time to have a public meeting, but we're going to do the best we can with it. I will at our public meeting on Monday, at our select board meeting, we will find a way for people to make comment by telephone. There will not be, thanks to the legislature for making legislation, there will not be a way to make comments in person. We're trying to avoid that kind of face-to-face contact, but there will be a way to call in. I'll write an op-ed piece about that this week and let people know how that works, and it will also be on the agenda for the meeting. So we all have to keep on keeping on. It's going to be a tough sledding for a few weeks here, but after that, let's hope that things start to get better, and let's just hang in there and take care of each other. Thanks very much, everybody.
Thank you, Donald.
Talk to you soon. Take care.